Hey, Alpha Nurses, I'm Licensure from alphanurseguide.com. This is 12 practice NCLEX questions. Without the way, let's get started.
A client diagnosed with undifferentiated schizophrenia gained 50 pounds in 6 months while taking olanzapine. After seeing her psychiatrist who changed the medication to ziprasidone, the client tells a nurse, "I don't want to take this ziprasidone either. I can't gain any more weight." Which response by the nurse is most appropriate for this client? 1. Ziprasidone causes less weight gain than the other atypical antipsychotics. 2. We can give it to you as an injection rather than in capsule form. 3. Abnormal movements are not as common with ziprasidone. 4. You can take it just before bedtime, so you won't need a snack. The correct answer is 1. Most clients experience less weight gain when taking ziprasidone, although ziprasidone can be administered intramuscularly. It can be used only on an as-needed basis by this route. Ziprasidone has fewer extrapyramidal side effects, but that is not this client's major concern. Ziprasidone is better absorbed when taken with food, so a bedtime snack is needed. The nurse reviews an arterial blood gas report for a client with chronic obstructive pulmonary disease. The results are pH 7.35, PCO2 62, PO 270, HCO3 34. The nurse should first 1. Apply a 100% non-rebreather mask. 2. Assess the vital signs. 3. Reposition the client. 4. Prepare for intubation. The correct answer is 2. Clients with chronic COPD have CO2 retention, and the respiratory drive is stimulated when the PO2 decreases. The heart rate, respiratory rate, and blood pressure should be evaluated to determine if the client is hemodynamically stable. Symptoms, such as dyspnea, should also be assessed. Oxygen supplementation, if indicated, should be titrated upward in small increments. There is no indication that the client is experiencing respiratory distress requiring intubation. The nurse teaches a client with chronic obstructive pulmonary disease to assess for signs and symptoms of right-sided heart failure. Which of the following signs and symptoms should be included in the teaching plan? 1. Clubbing of nail beds. 2. Hypertension. 3. Peripheral edema. 4. Increased appetite. The correct answer is 3. Right-sided heart failure is a complication of COPD that occurs because of pulmonary hypertension. Signs and symptoms of right-sided heart failure include peripheral edema, jugular venous distension, hepatomegaly, and weight gain due to increased fluid volume. Clubbing of nail beds is associated with conditions of chronic hypoxemia. Hypertension is associated with left-sided heart failure. Clients with heart failure have decreased appetites. The nurse is teaching the client how to use a metered-dose inhaler to administer a corticosteroid. Which of the following indicates that the client is using the MDI correctly? Select all that apply. 1. The inhaler is held upright. 2. The head is tilted down while inhaling the medicine. 3. The client waits 5 minutes between puffs. 4. The client rinses the mouth with water following administration. 5. The client lies supine for 15 minutes following administration. The correct answers are 1 and 4. The client should shake the inhaler and hold it upright when administering the drug. The head should be tilted back slightly. The client should wait about 1 to 2 minutes between puffs. The mouth should be rinsed following the use of a corticosteroid MDI to decrease the likelihood of developing an oral infection. The client does not need to lie supine. Instead, the client will likely to be able to breathe more freely if sitting upright. A nurse is planning care for a 12-year-old with rheumatic fever. The nurse should teach the parents to 1. Observe the child closely. 2. Allow the child to participate in activities that will not tire him. 3. Provide for adequate periods of rest between activities. 4. Encourage someone in the family to be with the child 24 hours a day. The correct answer is 3. The nurse should teach the parents to provide for sufficient periods of rest to decrease the client's cardiac workload. The client's condition does not warrant close observation unless cardiac complications develop. The child activity level will be based on the results of the sedimentation rate, C-reactive protein, heart rate, and cardiac function. The family does not need to be with the client 24 hours a day unless carditis develops and his condition deteriorates. A 14-year-old girl with sickle cell disease has her 4th hospitalization for sickle cell crisis. Her family is planning a ski vacation in the mountains. What should the nurse tell the parents? 1. Encourage them to go on the trip. 2. Go on the trip, but find a sitter for the 14-year-old. 3. Suggest the trip be postponed until next year. 4. Explain that the high altitude may cause a crisis. The correct answer is 4. High altitude causes deoxygenation, which might precipitate a crisis. In clients with sickle cell anemia, cells sickle when the client experiences any situation where increased demand for oxygen is needed, such as an infection or dehydration, or when low oxygen concentration is experienced, such as in high altitudes or deep-sea diving. Crises can commonly be prevented by maintaining hydration. It would be unsafe to encourage the family, or to say nothing about taking client to high-altitude areas, but giving the parents adequate information will allow them to make an appropriate decision. Postponing the trip or leaving the child at home does not address the immediate concern for the child's health. A child with hemophilia presents with a burning sensation in the knee and reluctance to move the body part. The nurse collaborates with the care team to provide factor replacement and 1. Administer an aspirin-containing compound. 2. Institute rest ice compression and elevation. 3. Begin physical therapy with active range of motion. 4. Initiate skin traction. The correct answer is 2. The child is displaying symptoms of bleeding in the joint and factor replacement is indicated. The Rice method is used additionally as a supportive measure to help control the bleeding. Aspirin-containing compounds contribute to bleeding and should never be used to control pain. Physical therapy is instituted after the acute bleeding to prevent further damage. Orthopedic traction is considered in some rare cases during the rehabilitation phase, but not the acute phase. A multigravida client at 34 weeks gestation visits the hospital because she suspects that her water is broken after testing the leaking fluid with nitrazine paper. The nurse confirms that the client's membranes have ruptured when the paper turns which of the following colors? 1 yellow, 2 green, 3 blue, 4 red. The correct answer is 3. If the client's membranes have ruptured, the nitrazine paper will turn blue, an alkaline reaction. False positives may occur when the nitrazine paper is exposed to blood or semen. The definitive test for rupture of membranes is Fern testing, where amniotic fluid is allowed to dry on a slide and then viewed under a microscope. Dried amniotic fluid will form a Fern pattern. No other fluid forms this type of pattern. The nurse explains the complications of pregnancy that occur with diabetes to a primogravid client at 10 weeks gestation who has a 5-year history of insulin-dependent diabetes. Which of the following, if stated by the client as a complication, indicates the need for additional teaching? 1. Candida albicans infection. 2. Twin-to-twin transfer. 3. Polyhydramnios. 4. Preeclampsia. The correct answer is 2. Clients who are pregnant and have diabetes are not at greater risk for multi-fetal pregnancy and subsequent twin-to-twin transfer unless they have undergone fertility treatments. The pregnant diabetic client is at higher risk for complications such as infection, polyhydramnios, ketoacidosis, and preeclampsia compared with the pregnant non-diabetic client. Which of the following anticoagulants would the nurse expect to administer when caring for a primogravida client at 12 weeks gestation who has class 2 cardiac disease due to mitral valve stenosis? 1. Heparin. 2. Warfarin. 3. Enoxaparin. 4. Arteparin. The correct answer is 1. Although there is no completely safe anticoagulant therapy during pregnancy, heparin is typically the drug of choice. Warfarin, a pregnancy category D drug, can cause fetal malformations. Enoxaparin is sometimes used, But clients are typically switched to heparin near labor because enoxaparin used along with spinal or epidural anesthesia presents an increased risk of bleeding in epidural or spinal space. Artepirin also can cause fetal malformations. As hospital-based care has become more oriented to crisis intervention, criteria for admission to the hospital have also changed, which clients have priority for admission to an acute care facility. Select all that apply. 1. Clients who live alone. 2. Clients who are acutely psychotic. 3. Clients who are acutely depressed. 4. Clients who are dangerous to self or others. 5. Clients who are not sleeping and have a lack of appetite. 6. Clients who are not complying with medication regimens. The correct answers are 2 and 4. Safety issues, including protection of the client and others, are the priorities for admission. Acute psychosis commonly involves issues of safety. Living alone is not a sufficient reason to be admitted to a healthcare facility. Depression, insomnia, lack of appetite, and noncompliance are important issues, but not sufficient for admission unless combined with one of the other criteria. When developing a discharge plan to manage the care of a client with chronic obstructive pulmonary disease, the nurse should advise the client to expect to 1. Develop respiratory infections easily. 2. Maintain current status. 3. Require less supplemental oxygen. 4. Show permanent improvement. The correct answer is 1. A client with COPD is at high risk for development of respiratory infections. COPD is slowly progressive. Therefore, maintaining current status and establishing a goal that the client will require less supplemental oxygen are unrealistic expectations. Treatment may slow progression of the disease, but permanent improvement is highly unlikely.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.